There's many clinics in the world right now doing stem cells, some form of stem cell therapy, with different methods, with different styles, different kinds of cells. The ones that I'm using are the stem cell, which is coming from a human placenta. That's not the patient's cell, which is for me the best, because you're getting all fresh new information. In some countries are using the embryonic stem cells. Embryonic stem cells have been used for research. They're trying to do some of those methods for therapy in humans. In my case, I totally disagree with that. I don't like the idea of killing a human to help other humans. So it's from a human, it's from after the baby is born, so there's no harm done to anybody. The baby is a healthy baby. It's born through a C-section in order to avoid contamination of the tissue. The tissue is collected, studied right then. I personally take all the placenta samples to the lab myself, so I'm very careful. It's tested for everything that you can think of that could be transmitted, and with the best possible way, with the polymerase chain reaction test for the HIV, which rules out 100% of possibilities of HIV transmission. It's the syphilis, toxoplasmosis, cytomegalovirus, herpes, you name it, everything is checked. And after everything is clear, then it's processed for implantation in a special lab that I have, which is called lab. Some forms of this method were used years and years ago in Europe and in other countries. The thing that I added was, the methodology. That I changed the protocol. I do customize it. If I can say I created or invented something, it was that. The design of these particular methods that I do for particular conditions according to the patient. There's other methods out there that are involved other techniques. Some people choose to deliver the cells intravenously. I don't like that method. Some people do it more aggressively, doing intrathecally in the spine. I don't like that method. Sometimes they do it inside. They do try to inject the cells in particular areas of the brain. I don't like those methods. And why I don't like those methods? Because the possibility of inflammation of the area, the possibility of an infection of the area, encephalitis and myelitis, even the microembolism that you get from having a bunch of cells injected in your vein, that ends up in your lungs, and I don't like that. I'm doing it subcutaneously, and I think it's the most effective way, since the body has time to absorb it, has time to explore it, has time to adjust to it, and it has time to use it, because it's slowly reabsorbed by the body. So I prefer that method. Even though I have a chance to do any other or the other, I stick to this one that I've been using for 18 years, and without having any side effect besides the local inflammation that you can get in the area. Besides that, I have never sent anybody to a hospital, never, in around 3,000 cases of patients that I've seen. I've never sent anybody to another doctor because to deal with the side effects of this method. Thank God I haven't done that, and that's why I keep doing this method, because it's safe, it's reliable, I'm getting results, which is what people want. And people don't care too much about the method, but the result that you would get from it. So, even though it's not cheap, it's affordable for most people, and I like that also, because some methods are extremely expensive, and there's no risk of teratomas, or these tumors that you can have if you try the embryonic cell.